Right, welcome back to Morning Live. We talked about polio vaccination. 10 counties did their final vaccination practice. That was yesterday. It ended yesterday. And Nairobi County will be starting on Saturday 20th to 25th, where that day will be actually the final day where vaccinations will be going on around the Nairobi County. Of course, it means studio. I'm joined by Lillian, who's from the Nairobi County, and she'll be telling us about now what we expect in Nairobi, other counties from experience, other counties, how they've actually experienced this. And sad news that some parents also still don't believe that indeed polio is important. They keep the kids away from the vaccination. Good morning, Lillian.
Good morning.
Karibu sana. Yes, 10 other counties did the whole vaccination practice. It went well, and right now Nairobi is here. Of course, Nairobi, one of the most populated cities in this town. In fact, it's a capital city, the most populated actually. And how prepared are you maybe now to traverse all these areas? Because now, as you told, some parents in other counties refused. That's kind of very strange also, but we'll talk about it later. But still, how prepared are you?
We are prepared as a county, being led by the County Health Services, working closely with Ministry of Health, UNICEF and WHO.
Okay.
We already have teams of vaccinators assigned to go door to door within the 17 sub-counties that we have in Nairobi. The team vaccinators, those are the nurses, the trained staff, will also be joined by a community member or a community health volunteer who knows the area very well. So it is a combined effort from the ministry, the county, and even the community itself.
Okay.
So the community members will be able to lead the vaccinators within the community. As you know, we have a lot of teams that will be traversing Nairobi, and some of these are the nurses who work either with the government hospitals or the private or the faith-based. So they do not know each and every area, and it's not within the areas where they live.
Okay.
So they need a guide to take them through. We've also gotten our vaccines. They are in the sub-county depots, ready for distribution to the teams. So normally when we are having a campaign, we get our vaccines from the main store, and they are delivered into the county, and the county logistician then delivers to the sub-counties. And we already know the populations that we are dealing with as per each sub-county. For Nairobi County, we are looking at 883,796 children. So we are doing more than half 800,083. 796 children for Nairobi County only. When we look at the national, they were doing 2.6. So it is right the way you've said, we are having the biggest chunk of children.
Yes.
Our approach to get these children vaccinated, our strategy is door to door, where we visit the households. Why we visit the households is because the children we are targeting are from one day, the child who has just been born, not yet even a day. So we call it from 0 to 59 months. And we don't want to miss any child. That is why we go to the doorstep of the household, verify whether there is any child who is below 5 years, and get the child vaccinated. We also look at the schools, because we know we have children who are less than 5 who are in the schools. So we visit the schools, we visit the ECD centers. In Nairobi is popular, and we know that we also have the young mothers who are working. Some of them leave the children in the daycare centers and even the baby care centers. We shall also visit that. When we look at the Muslim Religious Society, they have the madrasas and the duksis where they have those small children. We shall still go there. Also, we shall be going to the recreation spaces. Like on Saturday, Sundays, we know that there are very many children in Uhuru Park, in the playgrounds at home, in any other social setup near to their homes. So we shall also have teams that are passing through there. We are also visiting the churches, the mosques and the temples. So there is no part of Nairobi that will not be reached. We are also offering the same vaccines in our health facilities, both the public, private and faith-based. So we are trying to cover each and every child in Nairobi. We are also going to have some transit and mobile teams that are visiting the bus stations or terminuses the railway stations, the matatu terminus, the border terminus.
Okay.
So we look largely
So it's
at the
like
different
everywhere.
dimensions
Yeah.
of Nairobi. And like you know, apart from the over 800,000 children in Nairobi, we also have children who are on transit,
Yeah.
traveling maybe through the county. Maybe they are coming into Nairobi, they don't live in Nairobi. And others will also be coming from other counties through Nairobi as they travel. So all this is being put in place.
Okay. Wow, amazing. That's quite some work over there.
It's some tedious work.
Yeah, some work over there, because now by the time you say you're going to follow this kid in a madrasa, daycare, that's quite some work. Now, let's talk about logistics and operations, because now when you talk about all these things you've mentioned, that means there needs to be some proper planning. Now, for example, yes, I always see you guys maybe do some write-ups on doors just to make sure at least you've been here. But now looking at a situation whereby this kid, you've maybe immunized her or him in a recreational place. At the same time, you have to go and then maybe follow up at home. So the audacity of maybe the house managers to say, yes, you're done with her or him. Do you think maybe it will bring some confusion here? Because yes, recreation on Sunday, Saturday, but on Monday, you still follow up in the house, but they say, okay, this person or this kid, you're already done with her or him on Sunday. So how would that work out?
Okay, it's good you're talking about the logistics about polio campaign.
Yeah.
First of all, we do have a meeting at higher level at the county where we look at all the strategies and approaches that we are doing and assign teams with specific roles and responsibilities. When it comes to logistics of managing the vaccines, we have a team, the county and the sub-county logisticians, who just take care of the safety and to make sure that we have adequate vaccines to catch up with the population that we are looking at. We also have the health information records persons, who are the people who compile the reports of how many children have been reached from day to day as the teams come in with their reports in the evening. Then we have like I said, the vaccination team that is on the ground. Then we also have the disease surveillance, who are also working through, they work throughout the year looking for any suspected polio case and taking samples of any suspected case so that we may verify, is it polio or is it not? We also have the social mobilization teams, which are the health promotion officers and members of the community strategy services, who are the pace setters in the campaign. Because like we start telling people about the polio campaign before it starts. So we knew that in July we were going to start a polio campaign. So all the way from the 1st of July, we have done letters to the schools, done letters to the churches, to the mosques, to the ECD centers, to the administration, to business community. So it is far, large and wide. You even find we write letters to the Matatu Sacco chairman, the Boda chairman. So it is all inclusive. And especially in Nairobi, we've seen an approach that works very good for us. Most of the time you find that the men are not engaged in health matters and especially in vaccination matters when it comes to vaccination of the babies. So as we even do sensitization for parents, for the male population, for the teachers, for the administration, for various communities to understand all that comes around with the polio campaign. We are able to address any issues that arise. We are working very closely with other line sectors like the children's services, social and cultural services, education. We are also talking with the people from Nairobi Water Sewer, because as we know, polio is transmitted through oral fecal route. That is, you must have ingested either a drink or food that was contaminated with the polio virus. And the polio virus is only found in the fecal matter. So there must have been some issues with sanitation. Maybe you didn't do proper hand hygiene. Maybe you didn't do your food preparation safety well, storage. So we work with all collaborators, not only Ministry of Health.
All right. Now, some parents have been complaining about the side effects of polio vaccine. And Yes, an example where a parent, maybe the kid was double immunized, and there was a serious side effect of fever. Upon going to the hospital, now they'll be told, oh, the normal Calpol and painkillers, fever, maybe kind of short-term reducing agents didn't work. So what really happens? Because now, as I told you earlier, some parents are skeptical about now their kids being immunized, and they say even in some cases, death occurs. Is it true? Such issues?
What we know is that the polio vaccine that we are giving is oral drops.
Mm-hmm.
So we drop 2 drops in the mouth of the baby,
Mm-hmm.
and it is absorbed through the alimentary or digestive system.
Mm-hmm.
And once that is done, then the body picks up to start building immunity against the polio disease. What we know is that even the children who are in the ward and the time for vaccination has come,
Mm-hmm.
unless a baby is immunosuppressed,
Okay.
the immunity levels are very low, then even those who are in the wards are immunized when the time for let's say your baby got admitted like last week,
Yeah.
very severe disease, and today is their day for immunization. So long as the immunity is not down, we
Okay.
still immunize that child.
Okay, okay.
So there's nothing wrong with, we are very sure that our vaccines are safe.
Okay.
What we tell the parents is, maybe your child was in the verge of getting a disease,
Okay.
and as soon as we give the polio drops, maybe within some hours or a day or so, then the child develops illness. We always request the parent, the guardian, or the caregiver, could you, if you see anything out of normal, could you take that child to the nearest health facility
Okay.
immediately,
Mm-hmm.
for us to differentiate, is it an effect of the vaccination
Mm-hmm.
or a disease?
Okay.
And most often than not, we have found children are just sick.
Okay.
We remember that last year when we were doing the polio campaign, some people were complaining that the children were getting rashes.
Yeah.
Only did they not know the signs of measles.
Mm-hmm. Mm-hmm.
So as we were giving, there was a measles outbreak in some
Okay.
of the counties.
Okay.
And like it even prompted us to do a measles campaign
Okay.
in Kamkunji in December, because we were seeing many cases of measles coming up.
Okay. Okay.
So it is good for parents to understand, and also to get advice from a medical practitioner or the nearest facility, just for them to differentiate what is happening.
Okay.
But in case we think that this is a side effect of not only polio vaccine, any other vaccination, normally we have samples taken. We take that child to a health facility for observation, just in case it could go further than that is. And we are able to give results and tell the parent, is it a disease or it was effect of the vaccination.
Okay. Now, some people, we're told that they charge. Is it true? Some people charge, some are free, so there's no clear message on that. What really happens here?
All vaccines that are done within our country and which are within the immunization schedule through the Ministry of Health and the Division of Child Health are given for free in the public health facilities. And it is not that they don't come at a cost.
Okay.
They come at a cost, but the government, together with other partners like UNICEF, Gavi, and World Health Organization, they are the ones that pay for those vaccines.
Sure.
What I'd also like to tell the public is, at times people think the vaccine given maybe in a dispensary, a public dispensary, or a health center, or maybe one of our county referral hospitals, is of a lesser quality. What I should tell them is, even those that you get in the very high and elite hospitals are provided by Ministry of Health. Why they do charge is, if you ask them, they'll tell you they are giving you a service. The service is not free, just like they are giving any other service. Like if you brought your baby to, let's say, Ngara Health Center, we will weigh the child for free, we will immunize your child for free, and if the child is sick, we will treat them for free. But if you go to another hospital that is private, you will pay for all those services. So even if you go and get that vaccine from a private facility,
You'll have to pay.
they still have to charge.
Okay, okay. So we're taking a short break. When you come back right to Morning Live, we'll be talking about some other time, maybe let's say 1998, 1999, we had a campaign called Kick Polio Out of Kenya. And trust me, the frequency wasn't so clear, but I think it was a year or something. So when you come back, Lillian will be telling us about the frequency, because it feels like it happens so much this time around compared to the 90s. So we're coming to you after a short break. Memories. Welcome back to Morning Live. Yes, memories right here. And when you talk about the frequency of polio vaccination, in the 90s we used to have Kick Polio Out of Kenya. And it was a campaign that indeed kind of didn't materialize, because yes, the nursing fraternity really tried their best, led by the DPHN right now, of course, the county nurses. Lillian Mutu will be telling us more about that, but still, cases emerged again in Kenya, whereby now a few cases in Dadaab and of course in Isili, samples taken, and now we're back to square one. So back to what used to be a very solid campaign of Kick Polio Out of Kenya. People are branded with t-shirts, Kick Polio Out of Kenya. And I remember the office of the District Health Nursing Officer, that's the DPHN, used to handle all these things in the district. And it was very, very, in fact, colorful event, whereby nurses will traverse maybe the district, just immunizing children. It was a happy event. Right now, things have changed. Maybe, what happened to the campaign, Kick Polio Out of Kenya?
Okay, we were just, as a nation, at the verge of being certified free of polio.
Yeah.
As you remember, during that time, we were also collaborating globally.
Yeah.
You remember that towards 2012, that time, India got certified free of polio. And that is why even you and I, if we have to go to India tomorrow, we can't go without getting the vaccine. And if we do not get and land in India, we'll be quarantined. And they will have us receive the vaccine, observe us, then release us after a time. So this is a global strategy. We know that polio has to be eradicated. It comes with one who suffers having paralysis. And in fact, if it manages to affect you through the spinal cord, it causes death. So the way the hands or the legs will be paralyzed, then the brain gets paralyzed and you die.
That's it.
So it is that bad. We are working closely regionally to see that we also do the same. Right now we are looking at the polio end strategy game, which is a strategy that has started in 2018 to 2023. Why we give the many rounds? You remember some time back at Kakuma, we had some reported cases of people who are positive for polio. And this also happened in Lamu. And we've also had isolated cases of the people who have been diagnosed positive of the polio virus in Somalia and in Ethiopia. So anytime that such a scenario comes up, then we have to do another campaign. Why do we do these campaigns more than often? When we look at our immunization coverage for our children who are under 5, that means when a child is born, they need to get their first vaccination. That is against TB and against polio. That is the birth polio and the BCG vaccine. When it comes to 6 weeks, then they start getting the other additional vaccines. And this goes up to around 18 months. So there are those doses that they will get when they are 6 weeks, when they are 10 weeks, 14, and then they will wait for the measles 1 at 9 months, and then they will go for the measles 2 at 18 months. That is the national schedule of immunization. You might go to a private clinic where they are giving excess of this, but for what is aligned by the ministry, by the time a baby gets to 18 months, they should have cleared their vaccination.
Okay.
Then from 6 months and every other 6 months until the child gets to 5 years, they're supposed to get their vitamin S supplementation. And they're also supposed to be dewormed every 6 months. In Kenya, we have looked at an approach where children will only be dewormed twice. That is during the Malezi Bora days, that is in May and in October. And this, the child goes on with it until they are 5 years. Why do we do this? When a child is born, their body has not developed any immunity for either TB or polio. So we have to give this vaccination so that they can start developing that immunity. Why we give extra doses during the campaign is a booster dose. As much as you have given your child a vaccine, there is no significant scientific way of measuring. Is it at 100% or is it at 75? Or is it at 30? So everybody's body reacts differently when they are given that vaccine. There are those who will speed up and maybe build full immunity. Others maybe will progress slowly, just like we see the milestone of the children. Not everybody who is born today will walk at the same time or start crawling at the same time. So that is how the body acts. So why we give these booster doses, and it is not bad, it's because if your body has already converted the immunity of whatever you're being given, the excess will not be taken in by the system. It will just be eliminated. So it is very safe. So even if today we finish the campaign and within maybe some other months we hear that there's a positive sample taken and they have identified there's polio virus in that sample, or like we did in Isili and we found some positive sample in the sewer, it means there's someone who has the polio and is within our community or our society. And if you get one confirmed case of polio, then it means that person might have infected more than 200.
Wow, that's a big number. So the know-how, the idea to the parents that indeed this is a catastrophic kind of a situation. Do you maybe go to sensitize parents because they're young, new parents who really don't understand what happens? Is there maybe a campaign whereby also before the immunization practice now comes in, the parents know now the catastrophic ending of you or someone not immunizing their kids?
Yes, we are doing that, and that is why I say that like in Nairobi, we started, when we say we started mobilization, we do awareness and education at different levels, looking at who are our target population and what approach works best for them. I'm sure if you, like for the past 3 weeks, and very much active as from Friday last week, you will see some people who are donned in yellow polio aprons. They are not giving vaccines. They are only branded for visibility. They are just giving messages. You'll find that we've put posters. You've seen in the media there are messages that are running. Yes, for Nairobi didn't run. We ran for the 10 counties that have just ended yesterday. And today onwards, up to the 25th, we'll be playing messages about the polio campaign for Nairobi. We are also pushing e-posters and e-messages and some e-information on social media platforms, on Facebook, on Twitter handles. We are visiting churches and talking to people. We are really engaging, especially with men at the workplaces, because we know the men are the heads of the households. And it is also good for the man when he comes back in the house, just to ensure that his children have gotten the vaccination. We visit the market centers. We talk to the mamambogas. We talk to the hawkers. So we are really covering wide. You'd find at times some of the health promotion officers in the matatu, maybe a matatu plying across a route. We ask the people whether we can talk to their passengers as they ply the routes, and we tell them this information. And we have really found out that there's a lot of information gap, not only in polio but in health matters in Nairobi. So it's good that we start serious and vigorous conversations about health matters, about immunization. And even when I'm talking about immunization, it's just to bring to notice that if our Kenyan children were all completing their immunization as per schedule, without defaulting, with just meeting your appointment when you need to, letting the child go to the clinic until they are 5 years old, with us assessing what is happening on the ground, and also doing a lot of community surveillance. Like even as we do all this vaccination, and even in our day-to-day activity, we are educating people that in case there's a household member in the family, in the neighborhood, in a community, you just find that someone is, or a child or a young person or an elderly person, someone has developed paralysis of either the lower limbs or the upper limbs, that's the legs or the hands, without history of disease or history, bring it to our attention. Because if it carries more than 14 days, we might, even if it was polio, it might not test positive. But if we catch this information soon enough, we are only supposed to take some two stool samples. We take the first one, then within another 24 to 48, we take the second one and analyze whether it could be due to polio. So we are also doing a lot of community engagement for surveillance.
So if you have any question, just for Lilian Mutua, you can SMS us on 22999. I'll be asking her the question directly live here in studio, because now so many concerns coming in about the vaccine themselves. Now something else also, when you talk about now the safety of the vaccine itself, you know, as I mentioned earlier during the break, we have the cooler box, they work with them, and the ice pack sometimes, you know, due to the heat and everything, sometimes they kind of go, maybe the temperatures kind of go high, so that means the vaccines are exposed. Some parents actually ask the validity of the vaccines, the functionality of the vaccines in such environment where it's hot, because yes, they're supposed to be kept maybe at a frozen temperature. Yes, storage, preservation, very important, because from the hospital they're in a fridge. Now to the cooler box, also the temperature has to be maintained. But now, in the verge of these vaccines being exposed to maybe higher temperatures, that means there might be something. Does it have an effect in any way with the normal operation?
What we know is that, what we've said is that we are working with technical people, the nurses, or the vaccinators who go around vaccinating. In that cooler box, it's not just a cooler box. It has ice packs inside.
Ice packs, absolutely.
So this moderates the temperatures. And at any given time, even the vial itself, it has a vaccine vial monitor.
Is it still the rectangle traditional ice packs with the opening lid on top? Still the one? The traditional ice packs, actually?
No, yes, but not, the color is blue. And you'll find in each cool box we have around 2. And these ice packs are frozen before they are given out. They are completely frozen. So they are able to maintain the temperatures. And just in case someone feels like theirs is becoming a bit not too solid, they will always tell the team supervisors, and we have vehicles flying. So even if it's a vaccine that maybe you had more children than you expected, and you are almost running out of vaccines, you won't end there. There's another team which is just looking at logistics. That is within the former divisions that we had. So we are not only working as county, we have devolved the services down. So there are also teams which are looking at logistics, that is the vaccines, the management of vaccines, that is the cooling of them and making sure they are safe. So we are able to walk around, and we even have technicians just on hold, even for the machines. In case a fridge is not working, we are able to do that. In case there's power supply that is maybe going down, this is a crucial activity. Just like if you're in a facility and there's maybe there's a blackout, you'll find that immediately we'll call the KPLC and tell them what is happening within our facilities.
So for example,
and in our facilities, we run 3-phase. So it is not very easy to find that we are running out of electricity.
So for example, if a health worker comes in and maybe the parent notices that the temperatures are low in the ice pack, can they refuse? Because maybe will the vaccine maybe be exposed, or maybe something maybe negative happen to the vaccine?
What we know is that I've said we keep them with the required temperatures. Yes. And even for you to know that the vaccine is valid, in case you feel it's not very safe, you'll even be shown where we have the vaccine monitor on the vial. So even before I can give it to the child, there's a vaccine monitor on the vial itself, which tells me whether it is potent or not. And this is something that is done routinely, even the ones that are in the fridge.
Okay. From the 10 counties, there must be a report that indeed this will be experienced, the challenges and all those things. Is Nairobi now ready from what actually happened in the other county? Mombasa finished theirs, and their report might not be so different from what might happen in Nairobi. So from that report, maybe, are you ready to now take up the challenges and now make them better?
Yes, although this time round, there was more success reported than ever. And irrespective of the maybe few constraints that we have, especially in the other counties that have done, because when you look at these counties, most of them are in northeastern, around the coast like Lamu, Kilifi, and you know that people have to traverse with boats over the sea. And like for the nomadic population, you have to follow them where they've taken their herding. So in Nairobi, we also have the nomadic, especially in Langata, we have Maasais. In Ruai, we have Maasais and part of Embakasi. So even before the campaign starts, we've already recruited some of the elders and some of the young people from those communities to help us collaborate and keep track where their people are at any given time. Especially for our nomadic population, which is highly Maasai, we found very good response, and they are even asking us to educate them more on health.
Okay. Now, as we're finalizing this talk, there's this aspect of, it's a tug of war sometimes, and parents are always very cautious, very inquisitive. They want to know what is happening, the validity of the vaccine. Now, maybe, yes, it should be more of biological, maybe the chemistry part of it. But now, you see, when you talk about the central nervous system, it's very important in any survival of any creature out here, any mammal out here. But looking at the content of the virus, some people are kind of cautious about the impact. Talk about the future, not right now. The impact, or even normal operation, normal thinking of the kid, intelligence levels. There's so many stereotypes coming in and out, and parents actually the ones spreading this.
What I would like to ask our parents, this is the 21st century. Like you have rightfully said, you during our own conversation, and even when we were talking on air, you've said you know who a DPHN is.
Absolutely.
Because of when you were growing up.
Absolutely.
The memories. You can even vividly remember the cooler boxes and what you saw and those campaigns in the 90s. Then I'm imagining you are a parent. This is the 21st century. Your child grows up with polio. What will you tell them? Will you have an excuse of why they were not vaccinated?
That's a strong one. That's a strong one.
Just like me and you today, if our parents never took us to school, and we realized that we are not making it because our education was deterred at a point, what could your parent tell you? So even at this 21st century, what will you tell a child who is not able to be dependent by himself? He has, like if you have a child who has polio, we've seen this happen in families, and especially maybe I'd request maybe your media station to ask a polio survivor to come and talk and tell you the journey they've gone through. It is so bad that at times a young child will suffer polio and the father flees.
Wow. That's
the
bad.
Child gets polio, a parent has to stop working, and especially the mother. And even if the mother continues to work, they have to get someone to take care of that child. Maybe this child has paralysis of both legs. They have to be permanently on a wheelchair.
Wow.
If it is the hand that they were using to write, they have to start learning writing with the left. At 21st century, really? Is that the way we want to go?
That's strong. Sure, that's strong.
And if the developed countries have made it, we should be there. We should not wait anymore. Yes.
Now the fear
we should learn from what they went through and then assert to do the right thing.
Absolutely.
Yes.
Now, the fear of shortage, because now they say, this is a relief web says that private hospitals have been making big bucks as Kenyans pay 8,000 shillings to 20,000 shillings to have the children vaccinated. Now, the fear of shortage, because now this is a message that came from the relief web 2 days ago, that this fear that the vaccines, they may be declining. Is that true?
What I know is that there's vaccine management. And like I've rightfully said, the vaccines are not from Kenya.
Okay.
And they have to be brought from outside. We have adequate vaccines within the country. Only that, like what I'm saying right now, we might be looking at children who are around 800,000. And you might find that we go to maybe 800 or more.
Okay. Okay.
Maybe close to 900,000. And that is not our population for Nairobi.
Sure.
Just because we have other children. Like right now, Nairobi, we are doing the polio campaign. Kajiado is not doing. They are our neighbors.
Yeah.
Thika is not doing. They are our neighbors.
Yeah.
Machakos is not doing. They are our neighbors. We have seen parents from other counties, when it's only Nairobi that is doing and the neighbors are not doing, bringing into their children, especially over the weekend, because they know if their children come to Nairobi over the weekend, they will get it.
Yes.
So you find that maybe whatever we had for this goes a bit lower, but not out of stock.
Okay.
And then there's also, because the vaccine management is done even through an e-system, we are able to know if we have short supply of this in this county and we have a buffer stock in another county, we always borrow and replenish the other facilities.
Okay.
The only thing is that I also saw that the costs at the private facility, but I've said at public facilities we are giving for free. So if you have decided to go there, then we are lost for words.
Absolutely.
Yes, and we cannot talk for the private sector.
We used to have, a long time ago in the 80s, we used to have KP. Is it still there?
It's now division of, it's under division of child health.
Okay.
Yes,
Okay.
we still have that, division of vaccines.
So they still do all this, they catapult your efforts?
They do.
Okay.
Yes, they do.
So in terms of operation...
And it's not only about immunization. We are looking at immunization. We are looking at child health. We are looking at nutrition. Okay. There's HIV included. Okay. We know that there are children who are born HIV positive or born of parents who are HIV positive. So the division of child health has a chunk of programs, and immunization is just one of them. Okay. All right. Thank you very much, Lady Muto, for coming. Really appreciate your sentiments. For the hard talk to parents, you've actually given them that stance, because so many parents are trying to be doubtful of this immunization. Some articles, even main dailies, actually saying that the vaccines are not legitimate. They kind of now mess up with the child's growth. So many things, actually. But thank you so much for shedding that light. We just wish that we'd eradicate polio just the way like we did smallpox, and we'll be done with it. All right.